Hello guys, Vanakkam and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and CLEX and OET training. And today in Magic Pearl session, we are going to continue with the hemodynamic monitoring. That is part 2. We are going to discuss already part 1. The basics are covered in the part 1. So watch the video first. After that, you can come to this video. And if you like the video, please like it, share it and subscribe the channel so that it will motivate us to post more and more videos. Let's begin the session. So the first question is, the preference point for the measurement of jugular venous pressure is. Very important question. So many times this question asked in the exam. So the question is the preference point for the measurement of JVP. Where you will measure the JVP? This is the question. Okay, it is a direct question and they have given 4 options like sternal angle, nipple line, zippy sternum, and suprasternal notch. 4 options they have given here. They are asking the preference point for the measurement of JVP, and here the right answer is what? Option A, that is sternal angle is the right answer. So why I have selected this sternal angle? What is the rationale behind this? See, one by one I'm going to explain the key points, important points. Listen carefully. First, JVP, jugular venous pressure. What is that? It is the back pressure which is exerted into the jugular veins. From where the back pressure is exerted, it is exerted from the right side of the heart. From the right side of the heart, there is a backflow or a back pressure which is created by the right side of the heart and it is coming to the jugular veins. So we are measuring that pressure. Okay, so we are actually measuring the right atrium, pressure of the right atrium we are measuring here. Okay, so that is called as what? Jugular venous pressure. Okay, fine. So the next vital point is where you have to assess the jugular venous pressure. Okay, is there any angle for measuring the jugular venous pressure? Yes. See, sternal angle, it is also called as what? Angle of Lewis is an angle formed by the junction of the manubrium and the body of the sternum. I will be showing the image. Okay, so actually we are using 2 scales, one as a vertical scale, one as a horizontal scale, and a vertical scale, it has to be kept over the manubrium. I will be showing the image. Okay, so if you are keeping a scale over the manubrium, that area is called as what? Angle of Lewis. It is near to angle of Lewis. Okay, I will be showing the image. No need to worry about that. And the next one is, to estimate the jugular venous pressure, the patient has to lie down in semi-fowler's position. Very important point. This question already asked in the exam. All the points, all the 3 points, whatever I am discussing is already asked in the exam. To estimate the jugular venous pressure, the patient has to lie down in semi-fowler's position. That is 30 to 45 degree. If 30 degree option is not, that means you can go for 45 degree also. See, mostly image-based questions are very common here. The next one is the vertical distance between the angle of Lewis. Vertical means straight. The vertical distance between the angle of Lewis and the highest level of visible point of the internal jugular venous pulsation. Let me show the image, otherwise it will be difficult for you to understand. Okay, before that, before discussing the 4th point, let me tell the normal value. The normal jugular venous pressure is 6 to 8 centimeter of water. Okay, I will repeat the 4th point. Just I will read, just listen to that. The vertical distance between the angle of Lewis, vertical distance means the straight line, and the highest level of the visible point of the internal jugular venous pulsation. So jugular venous pulsation they will be assessing here, right? So where, at which point the jugular venous pulsation is visible. Okay, so these 2 area is going to connect. How? See the image. Yes, see, this is the area. See the center image. Okay, so this is the manubrium. Can see very clearly the manubrium. Let me first tell about the manubrium, angle of Lewis, all those things. See manubrium, this is the manubrium. Okay, you can see very clearly in this image. This is the manubrium. Okay, and this is the sternum. Manubrium, sternum. Okay, the manubrium and sternum, it is connected in a particular angle. It is called as what? Sternum angle. It is also called as what? Angle of Lewis. What is that? Angle of Lewis, also called as what? Sternal angle. This is the point. Okay, so from here a scale has to be kept vertically like this. Okay, so this sternum angle or angle of Lewis, a vertical scale has to be kept. Okay, and the next scale has to be kept by assessing the pulsation, which is the superior most area where you are feeling the pulsation. That area you have to keep the scale. So one vertical scale, and one horizontal scale, two scales you are keeping here. Okay, mostly you are measuring the right atrium pressure, right? So right atrium will be 5 centimeter from the jugular pulsation. See, this is the area where the jugular pulsation will be present, right? From here to here, from here to right atrium, if you are measuring in a scale, means it will be approximately 5 centimeter. It will be approximately what? 5 centimeter. And the angle what you are giving for the patient is 45-degree angle you are giving. So 45-degree angle, and you are measuring the pressure of the right atrium in the jugular venous pressure, and vertical scale you are using, horizontal scale you are using, and vertical scale has to be kept in the sternal angle or angle of Lewis, and the horizontal scale has to be kept in the superior, that is highest point where you are feeling the pulsation. Okay, so this is called as what? JVP, jugular venous pressure. Okay, so by this method only we have to assess the jugular venous pressure. Okay, the next question is it is also related to same jugular venous pressure. While measuring the central venous pressure, the 0 point of the manometer is adjusted to. Okay, so this is related to central venous pressure. Okay, so while measuring the central venous pressure, the 0 point of the manometer is adjusted to. 0 point they are asking. Very important question. Already asked in RRB examination. Let's see the options. Anterior axillary line, mid axillary line, posterior axillary line, and shoulder level. So where the manometer has to be, 0 level of the manometer has to be adjusted to. Okay, so this is the manometer and this is the right atrium. At what point the 0 point of the manometer is adjusted to? The 0 meter of the manometer is adjusted at the level of the right atrium. You can see very clearly the right atrium is here and the 0 point is here. So at the level of the right atrium, the 0 point manometer has to be adjusted. The 0 point manometer, this is the manometer, right? This is the 0 point. It has to be kept straight towards the right atrium. You can see very clearly, straight line towards the right atrium. What is present? The 0 point of the manometer is kept. Clear, guys? So which is the right answer here? Here option B, that is mid axillary line, is the correct answer. Okay, we have to keep in the mid axillary line. Okay, mid axillary line, right atrium is the place where we are keeping the manometer and we are maintaining the 0 level at the straight line of the right atrium. That's all. Okay, so whenever you are getting this question, that is 0 point of the manometer, two things you have to remember. The first one is mid axillary line and second one is right atrium. Okay, the next question is, a client has just undergone insertion of the central venous catheter at the bedside. Okay, a nurse would be sure to check the result of the which of the following before increasing the flow rate of the IV solution attached to the line. See, actually central venous catheter is inserted either in the jugular vein or in the subclavian vein. The central line is inserted, and now the nursing officer is going to infuse the fluid. Before infusing the fluid, what has to be checked? What has to be assessed? This is the question. Okay, so they have given 4 options like serum electrolytes, portable chest X-ray, serum osmolarity, and intake output chart. Okay, before starting IV fluids, just now they have inserted the central venous catheter. Before starting IV fluids, what has to be monitored by the nursing officer? And here the right answer is what? Option B, that is portable chest X-ray has to be done to confirm whether the line is in the correct placement. Okay, so the X-ray confirmation is very, very important before starting the IV fluids. Where the catheter will be? The catheter will be in between the junction of the superior vena cava and the right atrium. Okay, so you have to confirm where the central venous catheter is. Okay, by means of X-ray, you have to confirm it. Okay, so the next one is again scenario-based question of CVP value from the central line inserted via the brachial vein. Through the brachial vein, they are inserted the central catheter, central venous catheter, and CVP line inserted in a patient in ICU. Where they have inserted? They have inserted in the ICU. This procedure, CVP line insertion, is taken place in the ICU, and the patient is connected to the face mask with oxygen. Oxygen supply is going on for the patient. For the correct reading, the nurse should record the value at what time the nurse has to record the CVP value. Okay, so they have given 4 options. You understand the question, right? At what time the nurse has to measure the CVP, central venous pressure, during inspiration, during expiration, or during end of the expiration, or during end of the inspiration. Like that, they have asked the options. Okay, so this question already asked in the exam, and here the right answer is what? Option B. At the end of the expiration, the CVP, central venous pressure, has to be monitored. Okay, at what time they have to monitor? We have to monitor at the end of the expiration. The CVP has to be monitored at the end of the expiration. Okay, this question I think 3-4 times asked in the exams. Very important question. The last one is, a nurse is assisting the doctor with the removal of the central venous catheter. To prevent the complication, the patient should instructed to perform adjacent maneuver while removing the catheter, perform Valsalva maneuver while removing the catheter, turn his head to right side, turn his head to left side. Okay, so understand the question. They are removing the central venous catheter. While removing, what instruction as a nursing officer or the physician you supposed to give to the patient? Okay, what maneuver has to be followed by the patient? So this is the question. Very simple question, and this here the right answer is what? Option B, that is perform Valsalva maneuver while removing the catheter. The patient has to hold the breath. Okay, that is called as what? Valsalva maneuver. While removing catheter, it has to be done. Otherwise, what will happen? The atmospheric air will go inside the line. Okay, so in order to prevent this problem, what we supposed to do? Advise the patient to maintain the Valsalva maneuver. Okay, so this is how it goes. So thank you very much. So again, we will meet in the next magical session. So hope everyone understand the concept, whatever I discussed today. If you have any doubt anywhere, drop a message in the chat box. And if you like the video, please like it, share it, and subscribe to our channel so that it will motivate us to post more and more videos. Thank you very much, guys. And all the best for your upcoming examinations.